Hello and welcome to a brand new Mind Mastery video. In today's video, I'm going to try to compare and contrast schizoid personality disorder with complex PTSD, as I think there might be some similarities and differences in terms of the diagnostic criteria, and perhaps this analysis could help some people to distinguish whether they are having a schizoid personality disorder or complex PTSD, and also whether both conditions are actually one and the same condition, because that's also a possibility. So just a quick disclaimer before I'm going to move forward. I'm not a clinical psychologist, I'm not a psychiatrist, so I can't really offer professional advice in terms of this subject. So that's something to keep in mind. I'm going to try to be as objective as I can, and all my observations and thoughts here are based on my own experience in recovery and research, as well as working with my clients in my coaching practice. So I hope that's clear. So first thing first, what is personality disorder? Personality disorder is this unhealthy pattern of relating to other people, of relating to life itself, and it's usually based on, for example, destructive habits, cognitive distortions, behaviors that are not really beneficial to ourselves or other people. So that's in short. Some people theorize that certain personality disorders can correlate with our our biology. So in a sense, some people might be born that way. However, I disagree with that, and I'm going to post some studies in the description. I think that we are born with certain traits, for example, high sensitivity, that might make us vulnerable to developing certain disorders. For example, schizoid personality disorder. If an individual is born with particular tendencies, let's say, or particular temperament, they're going to be more prone towards towards being molded by the environment in a particular way, which might not be very beneficial to them. So I personally believe that personality itself is a combination of these genetic factors that might influence our development, but most importantly, it's based on conditioning and repeated learning. So we gain new experiences in childhood, we get rewarded and punished for certain things, and so we develop in a certain ways. We develop certain beliefs and interpretations of the world based on our past experiences in childhood, whereas biological factors might influence us or might push us into a particular direction. So the major traits of someone with schizoid personality disorder is having a certain preference for solitary activities, emotional detachment, not being very keen on forming attachments with other people, being generally very distant and aloof, and not going along with what the society wants us to think, but sort of taking an alternative route and choosing the solitary activities. So not being very sociable and not being very emotionally engaged. Some people might even experience something like emotional numbness, where there's nothing going on really in terms of the emotions. And that can lead to obviously not fulfilling relationships and not feeling like we are involved in anything around us. It's not entirely clear why this personality type develops, what are the actual causes, but from what I found and from what I understand is basically this combination of biological factors and social factors that influence us in childhood. It's basically hypothesized that what might be causing schizoid personality is kind of emotional deprivation in childhood. So lack of good connection with parents, perhaps being very distant, perhaps parents not being able to connect with a child, or feeling like they're not capable of doing that, or perhaps having their own issues. So because there is missing that authentic and intimate connection with caregivers, a person chooses this alternative way of development where they learn how to rely on themselves. And because they haven't had this very good connection with the caregivers, especially with the mother. They're not very good with their own emotions. So that would be one explanation. Another explanation would be the fact that something traumatic happened. And so that schizoid learns to distance themselves emotionally from themselves and from the world around us in order to protect themselves and protect their identity. So as a result of that, they start dissociating in order to protect this authentic part of themselves. So this dissociation causes them to shut down their feelings in a sense, or distance themselves from the feelings, where mentally they might be very present and they might, rationally connect with life and understand life, but since their emotions are very fragile and they haven't developed these abilities to cope with them due to that poor connection with their parents, they have to shut them down. It doesn't mean that these emotions don't exist. They might be very intense, in fact, and experienced whilst in solitude, but generally they are pushed away. So that's a very quick description of the schizoid personality. Now, if we flip to the side of complex PTSD, complex PTSD is a condition resulting from repeated trauma and stress. So it's usually not triggered by, or rather not caused by one single event, but repeated events, usually in childhood. Although I don't see the reason why it wouldn't develop in adulthood as well. So complex PTSD is distinguished by emotional flashbacks, which are this highly charged emotional states, resulting from kind of being triggered and interpreting emotionally and rather unconsciously present situation as if it was something that happened in the past. So that obviously will cause individual to act in specific ways, depending on how they react to their flashbacks and to the triggers that cause them. An individual might choose to fight, which is about fighting the emotions, fighting the trigger, not accepting what they are feeling, obviously. That's what the stress response is about. And generally choosing this more aggressive path of being. So because they experience these vulnerable emotions and unconsciously they might fear that they will end up exactly in the same vulnerable position in childhood. They have to choose this more aggressive response in order to protect themselves. So that could even involve abusing other people, if that would enable them to keep protecting their vulnerable self. Another response to emotional flashback and stress in general would be to use a flight response. So this is based on escaping the trigger, escaping the emotional reaction, escaping stress, and escaping anything associated with emotions that are being provoked. So underlying emotions of vulnerability, or stress, or fear, or anxiety. So someone who flights might choose to avoid particular situations. Such individuals might remain, for example, very busy or kind of very obsessive and compulsive about certain things, because that enables them to stay away from vulnerable feelings, stay away from anything that provokes stress. Other people might choose to respond to this emotional flashback and their own emotions and stress by choosing to freeze. Now, the freeze response is very similar, if not the same, to dissociation. So during freeze, basically an organism shuts down. Our emotions shuts down. We stop caring. We are not interested in relationships with other people. We kind of withdraw into our own internal world. Now, obviously, this is quite similar to, if not the same, which I'm going to try to analyze, to schizoid personality. Because in such a state, an individual basically just shuts down. They don't care. They're not interested in anything outside of themselves, only in their own internal life, because it's safe. It's safer than the external life. And finally, the fourth response to emotional stress or emotional flashbacks is to fawn. So basically, such individuals will try to please other people in order to cope with their underlying stress, anxiety, trauma, anything that's associated with this past memories, past experiences of being abused in general. So based on these 4 responses, we can see that individuals will act in specific patterns. And these patterns will determine how we approach life, how we approach relationships, how we interact with other people, what sort of roles we are playing on a regular basis. So someone with complex PTSD will usually overuse one of these 4 responses. So instead of being flexible, because we need all of these 4 responses in different circumstances, each of them is very useful. An individual with complex PTSD is basically stuck in 1 or 2 different responses. So obviously that's going to determine how we respond not only to ourselves but also to other people, because since complex PTSD is making you to re-experience the past trauma in your childhood, it's going to influence how you interpret your life, how you interpret your relationships with other people, how you interpret your experience. Because people with complex PTSD can get stuck in a flashback for not just for hours, but also for days or for weeks. So in that state, it might be quite difficult to actually be objective and see our experience for what it is, see people for what it is. And instead of that, we might be seeing them through the lenses of our past trauma or past abusive relationships with our caregivers. So based on these 2 brief descriptions of both conditions, we can see that there might be some similarities in terms of complex PTSD and schizoid, because both are related to our past, both are triggered in, or rather caused in our childhood. And my theory is that actually complex PTSD and schizoid personality might be one and the same condition. Might be, I'm saying might be because I cannot be certain and there are not enough studies to actually confirm it. The reason why I think there might be both in the same condition is because both are caused by the past trauma. And I think generally people imagine trauma as something physical. So trauma is that when you are being, for example, physically or sexually abused. But in fact, trauma can be caused also by emotional abuse. So if someone's parents are very cold, distant, not emotionally available or very inconsistently available, that's going to create emotional trauma in a child, because a child needs this consistency and feeling safe and feeling like, okay, they're welcome in this world. They can, go and explore. So they have the safe base in their relationship with their parents or their mother, from which they can go and explore the world. This isn't the case in complex PTSD, and possibly it's not really a case in a condition of schizoid personality, because in both states, the child eventually is unsafe. There's no safety in that relationship. Parents might be dismissive. There might be some physical abuse going on, but usually it's based on this emotional distance and aloofness coming from their parents. Obviously, we can see because of these 4 different responses to trauma and to emotional flashbacks in complex PTSD, we could see that schizoid personality could be explained in terms of the freeze response to stress. So someone who is schizoid could be said to have this constant freeze response. Maybe not constant, because there might be on and off times where, for example, in solitude, they might be able to connect with their own feelings and their own bodies. But depending on severity of the disorder, it might be very often where they can connect with some of their feelings at least, or it might not be existent at all, because any sort of feelings coming up to the surface might provoke a stress response, which is associated with past trauma. So that would be one explanation. If someone who overuses this freeze response, as in complex PTSD, we can see that a possibility for relationships is very remote, because if you are not connected with your feelings, you're not going to feel that having relationships with others is rewarding at all, because there's nothing going on. So you might talk to someone, you might interact with other people, but there's nothing going on in terms of emotions or rewards. So in that case, someone who uses this freeze response and keeps dissociating from their emotional experience and present moment experience obviously will display characteristics of someone with schizoid personality disorder, because there is nothing going on in terms of emotions, or there might be something going on but not sufficient to give an individual this experience of feeling the rewards from interacting with other people. So I think that both conditions are worth exploring on this deeper level. I know that for many people, complex PTSD can be very emotional. They might experience all this roller coaster of different emotions. And it doesn't really fit with the idea of the schizoid, who's usually quite aloof and, maybe even depressed, and there's not much going on. But at the same time, what if schizoid overuses this freeze mechanism, which is basically more or less the same as dissociation, which prevents them from experiencing fully these emotional flashbacks. And that's why when entering relationships or when going into therapy, which starts kind of provoking and awakening different parts of the mind, it might feel very overwhelming, because under the surface, there's like a flood of different emotions, feelings that are coming from the past, which are very difficult to process. So if you suddenly take away the freeze response or dissociation, it might be, traumatic in itself for the individual with schizoid to actually experience and to go through it. So that's something to consider as well. So that would be my short take on comparing and contrasting schizoid personality with a complex PTSD. What do you guys think? Do you think these two conditions are quite the same or different? Is there anything that you might find very important that are missed? All of your ideas are very welcome. And if you're interested in scheduling a session with me, I'm available for private coaching. Thank you very much for watching. See you next time.